cows are how you buy wives. Cows are wealth. And it's kind of funny. Like, I remember, you don't think about it, as a doctor, I was the colmadite of the clinic. I was the chief of the clinic. And I remember one time, I had a staff member come to me. He's like, oh, colmadite, I can't work today. Why? He's like, I'm getting married. Well, wonderful. Well, have you met this girl? He's like, no, I'm going to buy her. Like, really, how does this work? Well, I need to get cows first. Well, how are you going to get the cows? I'm going to steal them. When are you going to do that? Today. And sure enough, that night we'd get like 12 AK-47 injuries from a cattle raid gone bad. And it's like, we laugh about it, but this is how people live their lives. This is Nairo. These are some of our staff members, and these are some of my closest friends. Nairo, she helped in our compound to do the cooking and cleaning. She was sold to her husband when she was about 12 years old. Didn't speak any English, can't read at all. Just a caring, generous, giving woman. You could just see it in her eyes. And she would always cook for us, and if we ever ate everything, she'd think, oh, they like it. So we'd make it every night until we'd finally find a translator to tell her, please make something different. But you can see the ornamental scars are just magnificent, and she's just a beautiful, beautiful woman. This is James Toote. He was another one of my favorite friends. He actually fled to Ethiopia during the war and was able to get a primary school education. So he could read to about a 3rd grade level. He was a child soldier, and he was an amazing, amazing man. And in 2006, our clinic actually got looted and burned down because there was fighting. And what happens was when the fighting goes on long enough, the soldiers need to eat. So they burned down the clinic and they stole the food. And at the time, he was the head of our tuberculosis village. We do inpatient tuberculosis there. Most of you have heard of DOT programs, directly observed therapy as an outpatient for TB. Because this is a nomadic pastoralist culture, we had to create a village for them so they don't stay put for 6 months and get their TB treatment. Well, he was managing the TB village at this time. And when the fighting started, the expats all got evacuated out, and he led all of the patients out into the wilderness and continued their therapy for 3 days and then brought them back. So this is a standard I keep my medical students to. The guy can read at a 3rd grade level, and if he were born here, he would have been a neurosurgeon. This is Stephen Quell. He's another one of my good friends. Every time that he was the head of our outpatient ward, and every time there was fighting and you hear gunfire, he would come to our compound and tell us what was going on. Sometimes putting himself in harm's way, telling us everything's fine, it's just a quarrel among families, or this is going to escalate. And he was a friend. It's like on Friday afternoons after we get the clinic cleared out, we'd sit around and talk about women. This is the amazing guy. So anyway, this is our clinic. So I want to tell you, this is our front gate for our clinic, and we have a policy, no weapons. We are neutral, and we do not support violence, and we will treat anyone for free who comes through our door. But we don't allow weapons. And it's interesting because a lot of times we'd have armed men come in, and some of the most scary times in my life is standing before like 20 angry guys with AK-47s with a translator, not any idea what the guy is saying, I'm sorry, we're here to treat you, but we can't have you come in with weapons. Can you please leave your weapons outside? And just standing there going, this could be my day, but you know what? You got to stand by the principle because a hospital is a place of healing. You can't have weapons. So unfortunately, I couldn't find the photograph. I do have a picture of spears lined up on the outside because people weren't allowed to bring spears in either. And this is our local ambulance service. I got my start in medicine here in Santa Barbara County working for American Medical Response. So people would walk sometimes 2, 3, 8 days to come to our clinic. And here's the ambulance. Nothing that sophisticated. This is Brenda, our outreach nurse, and a happy customer. And this is Tom. Tom was our community health educator. And he would give lessons in public health to people while they were waiting to be seen. And Tom was really funny because he could speak at he could speak English and read at about a 1st grade level, 2nd grade level. But I remember, I learned so much from these guys, just so much. And the story about Tom is we had a polio outbreak. And polio is a disease that it's considered a one-disease epidemic. So for every case of clinical polio, you know that there's 200 kids without symptoms that are spreading the virus. So we had a laboratory-confirmed case. And we got it confirmed both in Nairobi and in Johannesburg. And then we went to the WHO and said, hey guys, we got polio. And they said, no, Sudan is polio-free. I'm like, And eventually there were just too many cases, and we did a big polio vaccination program. So I was trying to get people to come in to get vaccinated for polio. And so I started putting up trees of posters of limping children. And Tom's like, you stupid Kauai, you stupid white person. Don't you know if you want to do anything, you have to make a song about it? So he made up this song about the importance of bringing your children in to get them vaccinated for polio. And he went out in the community, and it had a very distinct melody, but he went out in the community and started teaching this song. And sure enough, 2-3 weeks later, you could hear people walking by singing this song. It was like a Billboard hit. It was awesome. And our polio vaccine numbers totally went up. This guy was my teacher, And here's some customers in our clinic. And this is our operating theater. We had solar panels on the roof and a battery so that we could have overhead lights when we operated. And overhead lights are a blessing and a curse. The blessing is you can see what you're doing. And I don't know if there are any surgeons in the room. Seeing what you're doing is important. The downside is that bugs are attracted to light. So with the overhead lights, you also get bugs in your sterile field. So I don't know what's worse, operating in the dark or bugs in the sterile fields. Either way, you hate the circumstance. It's not fair. Here's our dispensary where people come to get drugs. And here's our chief dispenser. All of our patients could not read. So when we would give them medications, we would have a piece of paper with a sun and a moon and little things for a full tablet, a half tablet, and when to take it. Because people are clever. Just because they didn't get a formal education does not mean they're stupid. And that's how we did it. Beautiful, beautiful people. So there's our inpatient department. This right here for the doctors in the room, the Paracheck, revolutionized tropical medicine. It's awesome. It looks like a pregnancy test, but it actually tests for the Plasmodium falciparum organism for malaria. 1 bar is negative, 2 bars positive. So anyone that comes in with fever gets tested for malaria. All pregnant women, malaria loves to hang out in the placenta, and pregnant women have a much higher incidence of developing cerebral malaria, which is often fatal. So all pregnant women got screened for malaria. And this thing, it was amazing. How many cases of malaria we treat a day? Malaria is awful. Horrible, horrible disease. Anyway, I can tell you, each one of these disease processes is a lecture in and of itself. This is our trauma ward, and every patient would come. We would give them a mosquito net, a blanket to sleep on, and we'd give them a week's ration worth of food that a caretaker, some family member, would cook for them. We didn't have the resources to actually have a kitchen and cook for them, which was a problem because if people came alone without family members, they either had to find someone to cook for them or sometimes they would starve. We didn't have the resources. We tried, but we didn't. So you can see this is our trauma ward. Here's another one of our trauma patients. He came in with an open femur fracture from an AK-47 injury, and we kept putting him in a traction splint, but he kept disabling it every night, so we finally put him in a full immobilization. And here's our pediatrics ward. You can see a mom with her baby there underneath the mosquito net. And you can see the pot where she does her cooking and the worn-out flip-flops. And this is our inpatient ward. This is no cottage hospital. All right? And we built a tucle for a morgue because, I've never seen mortality like I have in Africa. And when we've had our first case of polio, we turned it into an isolation ward. So originally, and one of our staff members wrote 4 died body, but it became our isolation ward. Sorry, my watch broke, so let me know if I start getting short of time. I don't want to. So just pictures for inpatient ward. This is our ICU. We called it our ICU because it was the closest to the nursing station because there were beds. And I know that there's a few doctors in the room, and and one of the things that we always say in medicine and nursing is you get to the point in your career, in your education, where you stop remembering disease processes and you start remembering the faces of people. And this woman here, behind her, you'll see there's a young boy who had second-degree burns, deep second-degree burns, 20% body surface area. A lot of burns. The reason why we saw a lot of burns is because people cook on the ground and because all the kids are vitamin A deficient. And vitamin A deficiency causes night blindness. So these kids would fall into the cooking